You're listening to the Heart of Giving podcast with Art Taylor, powered by bbbgive.org. Here we explore the motivations that form the basis of giving and service. We inspire generosity and celebrate the transformative effects that giving and service have on the human spirit and on community. The conversations featured on the podcast also uncover giving strategies that educate and provide tools to help listeners make impactful gifts of both their time and money. We hope you enjoy this episode.
This is the Heart of Giving podcast, powered by bbbgive.org. Give.org is the nation's standards-based charity evaluator, and it's your one-stop source for information on giving and reports on the most asked about charities. I'm Art Taylor. One of the things that we see quite substantially in the nonprofit sector are organizations established to deal with diseases, some of which we know very well and are quite prevalent, other diseases that we maybe don't hear about as much that can still be fairly prevalent in some form. And then there's some diseases that are just rare that we don't hear a whole lot about. And we're going to talk today with Scott Santarella, who is the CEO of an organization called the Alpha-1 Foundation. And they are working to address a disease with that similar name, Alpha-1. And we're going to learn about this particular disease and how it affects the human body, who seems to get it, and what his foundation is actually doing to help people who have it and maybe to eradicate it altogether. So, Scott, welcome to the Heart of Giving podcast.
Thanks for having me, Art. It's a real honor to be here. We're great admirers of BBB and the Wise Giving Alliance and the work that you do to give credibility to charities and nonprofits that are doing all they can to make sure we're being good stewards of donor dollars. So it's a real pleasure to be here. Thanks for having me today.
Yeah, well, Scott, and in following your career, you've worked in several different organizations that are fighting various types of diseases. Apparently, this has been something that has stuck with you. Talk about some of your previous experiences in some of the different organizations that you led and worked in.
Sure. I found my way into the nonprofit world, 25 plus years ago. Never found my way out. I've been drawn to, I think, disadvantaged, underserved, underrepresented type conditions and or issues. And it served me well. I've spent most of my career in oncology, first with the Multiple Myeloma Research Foundation, which is a very, very rare blood cancer. And then after that, I was with the Adarial Lung Cancer Foundation, which is now the go-to lung cancer foundation, and spent a lot of time in the lung cancer world. And then I found my way to the Alpha-1 Foundation, which is a very rare lung and liver condition that's genetic. That's my first entry into the genetic world of conditions and diseases. But I've just always found, I think at the end of the day, for me, if I feel like I did something good in the world or I feel like I helped somebody, it makes me feel good. And it's always been, I guess, a passion of mine. Don't know that I knew that at 22, but certainly as I'm closing in on 60, I feel like I made a really good choice and feel really proud about what I've been able to accomplish. And I feel like at the end of the day, I've helped a great deal of many people and families through the work that I've done. And that's incredibly rewarding.
Well, let's talk a minute about how nonprofits find themselves working to alleviate diseases. You know, we know in this country we have a very robust business and corporate community that focuses on disease management and finding cures for diseases. And that is one of the hallmarks, I think, of American healthcare, is that we have these companies that organize themselves in a way to keep us healthy through the drugs and interventions that they create in their labs and through their business options. But yet there are also these diseases that don't seem to capture the interests of these firms Is that when we see nonprofit organizations begin to step in? And what are the equations that keep these out of maybe the corporate lens and more into the nonprofit space?
I think oftentimes it starts with an individual, right? A person or a family that's affected by a certain situation, and they can't accept the norm of whatever that situation may represent, and so they decide to do something about it. And in the case of Alpha-1, it was a founder, John W. Walsh, who was diagnosed with the disease, looked around and said, God, there's nothing about this disease anywhere. I've never heard of it before. Maybe I can do something about it. And I think if you look at some of the, major charities in this country, I think of like the Komen Foundation, Michael J. Fox Foundation, the Prostate Cancer Foundation, they're started by individuals usually that just have a passion to want to make a difference and enact change, and try to transform an environment. And usually those individuals, if they're really successful or have the wherewithal, they've got a network of friends, family, contacts. Oftentimes they come from the business world, so they bring some business acumen into the equation. And I think that's sort of where things get started. I think the challenge always is how do you keep them sort of sustained? And, we're coming up on our 30-year anniversary next year. And I think sustainability comes from building community and finding other like-minded individuals to help you, finding other like-minded individuals that you can serve. And that then actually develops a community of support, of interaction, and of mutual goal and mission. And I think that's really what drives those organizations that are really successful in the nonprofit sector.
Yeah. And supporting health-related charitable organizations is, I think, one of the most compelling reasons why people give to charity, because they discover a disease that either they or a family member are affected by. And as you said, they want to do something about it. And they look for organizations that are out there working to either make it easier for people to manage the particular disease or actually find a cure. And in some cases, we know that people die from the particular disease, and a family member or a friend or someone connected to that individual wants to do something. And, we see when people die that oftentimes they're saying, don't give flowers, give to this particular organization. And it's quite compelling. And I also say, Scott, that a lot of times we look at these organizations not because they're going to find a cure tomorrow, right? It's always about the hope that one day they will find a cure. You and I'll probably remember years ago on Labor Day, we would stand around the TV for most of the day and watch the Muscular Dystrophy Association and Jerry Lewis convince us about the importance of giving to Jerry's kids who were afflicted with muscular dystrophy. And that is sort of a cultural sort of orientation that many of us have at that time about the importance of giving to disease-fighting organizations, because we don't want other people to have that disease, and we want to find ways to alleviate it so no one else, and maybe not even we, will end up getting that. So I think there's that hope that keeps us giving to these organizations. And many have been around for, as you said, yours has been 30 years, others have been 100 years.
Yep.
We still haven't alleviated the disease. And so it's not a question of impact, it's a question of hope. And I just want to make sure that we are very clear about that. The cure may not come tomorrow, but it's coming. And that's always the hope that we have in our disease-fighting organizations. They give us hope. When you go about, I want to talk about your organization in particular. And I also want to talk about how you go about giving us hope that people who are affected by this will be in a better place because of your existence.
I think the one way that we provide hope to our patient community, as to do a lot of charities like ours, we started as a foundation that was going to fund research and try to find answers. And I think in science and medicine and technology, especially when the three are married together, great things can happen. And I think that's where the hope starts, that someone's going to try to solve the problem. And then, as you mentioned, cures are hard to find. Problems in the healthcare industry are hard to solve. But if you have the right partnerships, if you develop the right collaborations, and you have the right like-minded stakeholders, especially key thought leaders, to help guide you, you can make great progress. And maybe you don't find cures, but maybe you extend lives. Maybe you improve the quality of life. You offer programs and services that make people feel not alone or feel desperate, right? You kind of calm their fears and you say, hey, we're here for you. We're going to help you through this. We're going to help you through this journey of your condition. And at the same time, on a parallel path, we're going to try to find a cure as well. And I think that's at the core of sort of the human condition. You mentioned it earlier. People, I think, inherently want to help one another. We don't always see that in today's world, but I think inherently the human condition is geared toward wanting to help one another. And sometimes it takes charities, because the government can't do everything for every disease and every condition. It takes charities to actually be developed to focus on particular areas, whether it's, social issues, health issues, philosophical challenges that we have in society. Sometimes it takes those nonprofits to come together to make change. And it's a pretty powerful thing when it happens. And there's nothing better than giving someone who's been diagnosed with a condition, hey, this isn't going to be the end. It's just the beginning. And there is hope on the horizon.
So let's talk about Alpha-1. What is it? How does it affect the human body? What are we learning about it?
It's a genetic condition. It's not considered a disease. It's considered a genetic condition. It affects the liver and the lung. It could affect both. It could affect one or the other. In simple terms, we all have a protein in our bodies called Alpha-1 antitrypsin. It folds and gets out of our liver, and normal people have no problems. For people with Alpha-1, there's a misfolding of the gene in the liver. Sometimes your liver clears it out, but it never gets into the lungs. So you have lung breathing issues, sort of like genetic COPD. And if it doesn't get cleared out of your liver, you have very severe liver disease, very much like you would find in, an alcoholic. So in our condition, we try to really do some preventative measures and tell people not to drink or to smoke. But it's a very hard disease to diagnose because most of the symptoms are shortness of breath, lethargy, not really feeling well. And so you go to your pulmonologist, and he says, you probably have COPD. And so there's a huge issue that we have in our condition with misdiagnosis. As an organization, we're trying to do a better job of detecting the disease. As I mentioned to several people earlier, we're primarily a Northern European genetic condition. That's where it was founded and has the major population of patients that come from that part of the world. But we are finding through science and discovery that African Americans are affected by the condition, as well as Latin Americans. And so we're in a really interesting time that technology and science is allowing us to actually take a deeper dive into this condition. And we're finding that it's not just going to be, a white Caucasian situation, but it's going to affect many more people, especially as the world becomes more and more integrated and society becomes more and more integrated. Yeah. And that's going to happen organically. We see that, every day, not only in the U.S., but across the world. So we have a huge challenge in front of us, but we're hopeful.
What's the scale of the problem right now?
Right now, we think in the U.S. it's about 100,000 or so people have the condition. In the healthcare community, any condition or disease that has 100,000 patients or less is considered rare, right? And so that's kind of why it falls into that rarefied area. Yeah. Part of our challenge is we know of about 10 to 15,000 or so patients that have the condition. Those other 80 or 85,000 patients that we think may have it haven't been diagnosed, or they've been misdiagnosed, or they just haven't been detected yet. And so we're doing a lot of work in our world to try to understand how can we work with pulmonologists better? How can we work with primary care physicians better? How do we educate the medical community? How do you educate, large populations of of people that are exposed to genetic conditions. And so while it's a challenge, I think it's an opportunity, right? And I think we have to see these things as opportunity. And we've got a chance right now in the alpha world because of things that are happening on the industry side, where there's some therapies in the pipeline, and
nice.
there's some hope for better treatment options.
This is why I wanted to really focus on what you're doing in the numbers, because someone might look at 100,000 people and say, well, that's not that many people. If you're one of the 100,000, it's a big deal, right? It's a big deal. And you wanting someone to be doing something about it. And this is when charitable organizations step in, right? It's that human concern. It's the personal agency that we take to solve problems when maybe the marketplace hasn't been able to rationalize why it should get involved. It's at this moment that I think charitable organizations shine and do all the things that you were talking about earlier. This is a great example, I think, of why we need charity in this country. Mm-hmm. It's a great example. Again, if you're one of the 100,000, it matters a lot that someone is out there looking out for you, doing their best to try to deal with this. So, and if you're not one of the 100,000 and you're a human being who's concerned for the welfare of others, and you realize that maybe the marketplace isn't doing much for these folk, this is where I can plug in with my dollars and try to help someone who isn't going to be helped by our big systems, So I just wanted to put that out there, Scott, and help people appreciate again why it's so important that we have charitable organizations and why it's also important that we support those organizations. Yes, it's important that we give to individuals too, but it's important that we support institutions that are trying to make a difference, because you're organized in a way, and we're going to talk about that, how you're organized and what you're doing. You're organized in a way to help solve this problem, to give the best thinking to how we can go about solving this problem. So let's talk about that some. How are you organized, and how are you planning, and how do you plan to attack, and how have you been attacking it?
It's a great question. We have over 30 years developed a very strong board of directors, 75% of which have to be patients or patient family members. So we've got a direct, passionate connection to the condition. We've got an incredible research advisory board that helps us make really good selections on the research that we fund. We follow the NIH review process, 2 reviewers, so that we're making really good bets on really good grants in science when we actually dole out those dollars, those donor dollars. We've got a complete 360-degree patient and family program of services and support efforts where we support groups and oxygen funds. We do national conferences for the community every year. We have education days that we do in person. Everything we offer is virtual. We learned in the COVID world, COVID environment, that we had to offer virtual education to people because people were homebound. We opened up a whole new world of patients we couldn't get to because they were homebound because of their condition. So we've actually, we think of ourselves as a one-stop shop for Alpha-1. We're the primary charity in the space for Alpha-1 antitrypsin deficiency. And we serve the community, not just, as I mentioned earlier, not just the patient community, but the medical community. We have CME programming. We feel like we've got all of it covered. And we do that basically because of the support of the community, the support of our industry partners, the support of donors. Charities need funds to sustain themselves. And we want, our donors to understand that we're doing everything we can to be completely transparent and making sure we're doing the best and being the best steward of those donor dollars. And that's why, opportunities like this and the Wise Giving Alliance and BBB are so important to get those accreditations, because it validates the work that we do as an organization. And we need that, right? It's a competitive market. And you have a lot of choices out there on where you want to put your charitable donations. And we hope that you'll choose us or choose one that is doing equally right by their community.
Yeah. Well, I'm happy to mention that you are an accredited charity and you've gone through all of our 20 standards and meet them all. And so you should definitely expect to get support from organizations and individuals. And if people who are looking for an organization to give to, they can feel confident that you're going to use that money in the way it was intended.
Right.
So I want to talk, Scott, about some of the challenge opportunities that you've seen and some of the progress that you've made over the last 30 years with this particular disease, or I should say condition. It's not a disease, it's a condition. What have you seen over the last 30 years?
One of the things that is available for patients that are diagnosed with Alpha-1 is, especially if they're lung affected, is something called plasma therapy. So you can actually get plasma donations and get plasma therapy to help provide you the Alpha-1 antitrypsins that you're not getting from your own body. It doesn't help fix the lungs, but it helps keep you at a stable level so that you can survive. What's really exciting about what's happening in the world today for Alpha-1 is there's some companies that are working on therapies that will affect both the liver and the lung condition. And technology around gene editing and the gene therapies that are out there now has really opened up a brand new marketplace for industry to look at Alpha-1 because of its genetic nature as a great opportunity to test some of their therapies in. And we've got some companies with drugs in their pipelines, with therapies in their pipelines, some that are in phase 1 and phase 2 clinical trials, which is really important. We actually have a patient registry, which allows us to actually identify patients that are interested in being part of studies and trials to help advance the field. And so if you're newly diagnosed today, there's a tremendous amount of hope. For those that have been living with this disease for 10, 15 years, that hope is finally here for them. They've heard about it for a long time. Now they're actually seeing it come to fruition. And we're really excited about that. And we're grateful. I look at the Alpha-1 community and some of these rare disease communities where we are today is where oncology was 15, 20 years ago, right? Mm. It used to be then breast cancer, you give chemotherapy, you give radiation, you treat every woman the same. And then they started to uncover different genes, the BRCA gene, right? Different biomarkers. Then you realize you got subsets of these conditions and diseases that you have to treat individually. You really have to treat the patient sort of at the right time with the right drug and the right patient. And that's really unique about where science and technology is today. And a lot of that we've learned in the oncology world is now starting to trickle into and transfer into some of these other health and rare conditions. And that's really exciting.
That is exciting. And it looks like companies have found a way to work right alongside of you now because there's a business case that can also be made.
Absolutely.
And how are they making that business case, Scott, in your estimation?
Well, based on some of the research that we funded 10 years ago that sort of validated hypotheses, they were able to learn from some of that data and those outcomes. And from that, we're able to say, hey, we've got something in our pipeline that fits that hypothesis. Let's see what it looks like. Then they reach out to us because we have such a pulse on our community. We've got direct access to patients, and we're able then to provide them the education they need about our community, what our community needs and wants, and how they can actually work with us as a partner to actually get patients to participate in the studies that they're trying to conduct. And that's a real, it's a unique situation to have because not every rare disease is going to have something in a pipeline. But it gives other rare diseases hope that they could get there, right? And I like to tell patients, especially the ones that are newly diagnosed, things don't happen overnight. You just said it. Sometimes it takes 30 years to get to where we are. And we're really fortunate that I feel really fortunate. I've been involved for 3 years at the Alpha-1 Foundation. I inherited an infrastructure and an organization that was second to none, that was incredibly credible and actually was, doing great things. And I've been able to build on that now and be able to move things forward in a way that I think is going to be really positive and impactful for patients. But it takes time and it takes a lot of energy and a lot of passion.
Yeah. Talk about passion. I mean, you have a board of directors you mentioned made up of people who actually have the disease. You said something like what percentage of them?
75%.
75%. Yep. What are your board meetings like when you have people who actually have this condition sitting at the table, helping you make decisions about what research you fund, what programs you institute, how you go about fundraising, and so forth. What's that like?
It's a great question. It's very strategic. Our chairman of our board, John Hagstrom, who's a double lung transplant, ZZ Alpha, he's got a business background. So he brings a business sort of kind of environment to the board meetings. We've got doctors on our board that actually guide us with the decisions we need to make. And then we have patients that are incredibly well educated about their condition and well educated about the healthcare system. And so our board meetings are very focused on how do we achieve our mission? What are the priorities that we have as an organization to achieve that mission? Science and research are always number one. Patient services, patient support are number 1A. And we have sort of a very simple sort of caveat. If it's good for patients, we're going to figure out how to do it. If it's not good for patients, we don't do it. So we don't waste a lot of time on things that we don't think are going to be good for patients. And we keep that patient centricity, which is another advantage to having patients on the board. The patient's never forgotten, right? The patient is put front and center. We actually hold scientific conferences with our key thought leaders, and we have patients at the table, right? Because patients have to have input in how science and medicine is going to move forward. Patients need to have input in what type of trial they're going to go to. You're going to make a patient go to a trial once a week, every week for 6 months. You've got to actually have some conversations with that patient. Will you do it? Can you do it? What do you need to do it? And those are the types of things that we have as conversations at our board meetings. We hold 4 a year. To me, they're incredibly business focused, right? We're running a business that doesn't put money in our pockets as shareholders but we take that money and we reinvest it into our mission. And what we're doing is we're trying to, again, provide that hope for patients that we're going to deliver for them and improve their lives.
Yeah. Well, you mentioned earlier too, Scott, that it's important how you use your money and that people are aware that you're putting that money to great use. We're seeing in our society at large, people not trusting institutions in much the same way as they used to. And charities, while they're still among the most trusted, are feeling some of that. What does your organization do to try to assure its donors that you're trustworthy? Not just donors, stakeholders too, because people who want to use and be a part of your interventions, they've got to trust you too. What is it that your organization does to help people know that you're trustworthy?
I would say we're incredibly transparent. We share our audited financials. You have access to them. Anybody who wants, to see our 990s, we share that. We look for accreditations like the Wise Giving Alliance, the others that are out there that we look to get accreditations for. We create a report to funders where we actually put together the impact we've had each year so that they can see where their dollars have had impact. Not just an annual report, a report to funders that's an impact report. Mm-hmm. We do an annual report, right, so that people can see as an organization, how we're operating and how we're actually spending money. And we spend a lot of time in our community. We have a lot of face-to-face time. Thank God COVID is over with in a large sense. But we spend time in our community. We spend time speaking to our doctors. I spend a lot of time traveling, the country and the world, actually, meeting with key stakeholders, making sure that we're being a good partner, making sure that we're answering their questions, making sure we're there for them, and listening. Probably the most important thing that we do is we listen. We listen really well, and we take back what we hear, and we try to implement the changes that we think we need to make based on, those comments and those insights that we get from the community. Yeah. And, I think that's served us well. We've got a great reputation, and I think we feel a tremendous responsibility to be good stewards of donor dollars because we know how hard it is to make a donation, and it's not easy for people. Yeah. And we don't want people to feel like they're not getting their values worth.
Yeah. Well, we're about to the end of this, Scott, but I wanted to just give you one opportunity to tell people how they can be helpful to you as you go about addressing this condition?
Well, the first place to start is you can visit our website, alpha1.org. Certainly can find out more about things that I talked about today and can make a donation. I think also, if you're a person out there that's suffering from, shortness of breath or, not feeling well, maybe feeling a little bit jaundice or something, go to your doctor and ask them. It's it's a cheek swab test. Everyone's used to it now because of COVID. You could very quickly find from a primary care physician or a pulmonologist or hepatologist whether you have Alpha-1. And what we have found is the best way to actually survive and thrive with Alpha-1 is be diagnosed early. The earlier you're diagnosed, the better we can actually help you, and the better we can get you on a pathway toward feeling better. So I would say, visit our site, alpha1.org. Know your body. I think one of the things I've learned over the years, and I'm sure you two have, is the more you know yourself, the more that you are your own advocate, the more success you're going to have in your own health care and condition. Yeah. And so you have to really be on top of how you feel and make sure you visit a doctor and make sure you stay healthy.
Well, you've been listening to Scott Santarella, who is the CEO of the Alpha-1 Foundation. And you've heard now about the condition itself, what they're doing about it. And I want to thank you, Scott, for joining us today and for what you're doing to give people who have this condition hope.
Thank you, Art, for the opportunity to share our story and about our foundation. And thank you for all that you do in your work. Really appreciate it.
Well, for all of you who are listening for the first time, this is the Heart of Giving podcast. It's a weekly show. Every week we come out with a new episode on Tuesdays. So I hope you will subscribe on all major podcast platforms. And if you're interested in seeing the video version of this, you can go to the YouTube page for the BBB Wise Giving Alliance, where it will be posted there. Or you can go to give.org's website, where you can also make a donation to the give.org organization. And we will certainly put that money to great use. I want to thank you for listening, and we'll see you back here hopefully next week.
You've just listened to the Heart of Giving podcast with Art Taylor. Be sure to tune in next time for a brand new episode. To listen to our other interviews, visit heartgiving.podbean.com. That's heartgiving.podbean.com. Subscribe to our show on major podcast platforms. The thoughts and opinions expressed on this podcast are the views and opinions of the guests, not those of the BBB Wise Giving Alliance or program affiliates. This podcast is for information and educational purposes only and is copyrighted with all rights reserved. This podcast is protected by Podbean's terms of service.